Doug Jones said that Alabama is now re-entering or rejoining the Confederacy. I thought that was a very strong statement and a great way to really encapsulate not only the symbolism of what is happening here, but what it portends for our state, potentially, if we don't stand up and fight this. The other thing I want to point out is what Reverend Raphael Warnock said, U.S. Senator, current sitting U.S. Senator from Georgia. He said, "We are at a crossroads where politicians are picking their voters." Picking their voters. He went on to say, further down in his statement, "We are straying further from the core voting principles that help create the diverse body that people see representing them today. Our democracy is on the line." I don't think either of these men have overstated the potential crisis we are facing here if we do not fight back.
Alrighty, welcome in. It's another fabulous episode of your favorite political podcast. It's Alabama Politics This Week with Josh Moon and
David Person.
How are you, David?
Well, I'm still trying to decide after yesterday or last night's Supreme Court ruling and what that portends for our state. I'm still trying to decide, but I guess it's a new day, so got to be optimistic, right?
They do just keep kicking you in the head, though.
They do.
So it's and have no qualms about it whatsoever. Law, precedent, none of that matters anymore. Don't even worry about it. All right, so we're going to talk about that. We're going to talk about Tommy Tuberville and his tax returns and what that means for this new fight for over his residency and a bunch of other topics. But before we do, we need to tell you about our friends over at Wind Creek Entertainment. They are fantastic folks for this state, and if you don't believe it, just go and stay a night. You will receive service like you've never had before. You'll enjoy yourself. You'll eat great food. You'll have the opportunity to go to a fantastic top-level spa at those places. You play great games as well. If you're into the gaming over there, I recommend it. I played the games when I was there. I had a good time. I didn't walk away Larry Langford style with any cash in my pocket. But I don't gamble a whole lot. I was looking for that. Apparently the Porch Creeks don't do the Larry Langford machine. So, and I'll tell you this, that was quite a bit of BS as well. I know the kind of the backstory on a lot of that, and that was not really what happened. But, anyways, but it's funny. It's funny to say, now, rest his soul.
From the past.
Yeah, right. But the Porch Creeks are a top-notch, top-level group of folks, and that's the reason why they operate 3 of the best casino resorts in this state. They operate some of the best hotels in this state. They are the state's #1 hospitality employer. They pay a fantastic wage. They treat their employees well. You go into there. That's the reason why you receive such high quality service, is because they are treating the employees well and they're happy to work there. That's the difference. So go in, check them out. Wetumpka, Atmore, and Montgomery is the 3 locations. If you're driving down to the beach sometime, pull in, stay a night. You will not regret it. Look them up online at Wind Creek Entertainment. All right. So, the Supreme Court recently overturned the Supreme Court, the same one. And they're going to allow Alabama to use racist maps. And that's not me calling them racist maps. The 3 judges that on the federal bench called them racist maps, referred to them repeatedly as racist gerrymanders. Yeah. You know who agreed with them? This same Supreme Court agreed with them. Yeah. They also agreed with them when they refused to let these maps stand just, 2.5 years ago, refused the exact same maps. So now all of a sudden these maps are okay because the Republicans are facing basically a firing squad in the midterm elections in November, and they're looking desperately for some help. And they have justices who don't give a shit about the law or precedent or adhering to some standard of judicial service. Like in the past, you can look back at a lot of things. And I don't think even some of the more egregious things that you disagreed with, the Dred Scott decision, things like that in the past, not in any way saying that is a right decision, of course. No, it was a horrible decision. But when they meant to make that decision, because of the times that they were in, that there was precedent out there. There were laws that they were pulling from. There were things that they were drawing from. This is nothing. They're just making this shit up out of whole cloth. They're just absolutely making it up. They're reversing themselves on the rulings that they made 2 years ago. The exact same court with the exact same maps doing this right now. And it's only for a partisan purpose. And you know that's what it is. And they don't give a shit that they've disenfranchised black voters to get there. That's just the bottom line.
Yeah. Yeah. And not only have they disenfranchised black voters, I would argue that they are putting a really unfair burden on the state of Alabama, even though this is something that the people that lead our state wanted. They wanted this unfair burden. And when I say unfair burden, I mean the fact that they are forcing the state into a crazy time crunch in terms of trying to reallocate voters to conform to the various districts. So it's easy for the legislature to say, hey, we're going to push this map, which, as you just said, has already been determined to be a bigoted map. It's another thing for the governor to spout right-wing talking points as justification for this. But it's a whole nother thing as you get deeper down into the structure of the state and the election process, for the people that actually have to do the work of trying to navigate all of that. So
I don't know if they're going to be able to do it.
It's wrong on a lot of levels, and then going back to the court, it's it just seems like, it goes to the problem, Josh, that I think a lot of people have talked about, which is this egregious use of the shadow docket, because they are making these rulings in a way where they are really not allowing their logic to be scrutinized there. And that speaks to, I think, what you just said, which is that, perhaps it's because there really isn't a logic to it at all, at least no logic that would meet the standard of fairness and justice,
to back up and support what you're saying.
Yeah, that's right.
In the very decision,
That's right.
In the very decision, that you're talking, that we talked about Calais down in Louisiana that started this mess. Okay. In that decision, they themselves, Alito, in writing that decision, said the Alabama case, which they've now reversed twice, was still good law. It was still good law. These maps were not racially gerrymandered. They were not set up to provide based strictly on race. They were set up and drawn in a way that was fair. And so they called that good law. And then I assume Clarence Thomas wrote this ridiculous. I mean, because that's the other thing that gets me. The cowardice of this is really off the charts, because this is not an opinion from the court. Okay, this is not a standard opinion from the court. This is a shadow docket ruling that is unsigned. Nobody is taking claim for this thing. No one is claiming it. Apparently the 6 justices voted for it, because we know the 3 liberal justices dissented on this and and with really dissents that are worth reading. The dissent's worth reading, because it's ludicrous what they're doing. I mean, it so far outside the bounds of the law, and it's not even. When I talk about that, it's not a partisan issue that I'm talking about. I get that there are different ideologies on the court, okay? And there always have been. There have been more conservative, of course. There have been more liberal courts, and those ideologies have carried through. But when in passing rulings and in doing things, there has been a basis and a precedent that they have relied upon and that they have moved forward with that set laws in place for certain things, protecting people's rights and making sure that people were not disenfranchised. This is completely the opposite of that. You have removed laws that good and well are going to disenfranchise voters. Because you've said it yourself, this map packs black voters into a district. And it dilutes their votes. You agreed with that ruling, and now you're going to come back and say, to hell with it, for a partisan purpose.
I want to point out something. That a former U.S. Senator said and a current U.S. Senator said. I'm going to start with the former U.S. Senator, because he is an Alabamian, and that's Doug Jones, who's running for governor. Doug said in a statement after last night's, and I'm saying last night because even though this is dropping on Friday, it's Wednesday morning. So this is the morning after the ruling was issued. Doug Jones said that Alabama is now re-entering or rejoining the Confederacy. I thought that was a very strong statement and a great way to really encapsulate not only the symbolism of what is happening here, but what it portends for our state, potentially, if we don't stand up and fight this. The other thing I want to point out is what Reverend Raphael Warnock said, U.S. Senator, current sitting U.S. Senator from Georgia. He said, "We are at a crossroads where politicians are picking their voters." Picking their voters. He went on to say, further down in his statement, "We are straying further from the core voting principles that help create the diverse body that people see representing them today. Our democracy is on the line." I don't think either of these men have overstated the potential crisis we are facing here if we do not fight back. And I'm not even sure, even as I say this, Josh, I'm not even sure exactly what fighting back looks like altogether, but I know that we cannot afford, and when I say we, I mean not just black people or brown people, but white people. I don't just mean Democrats, I mean Republicans and independents also. If we don't stand up against this, this is going to be something that affects, I think, all areas of our democracy and really will threaten it and really take us back, literally take us back 200 years. And that's back to the pre-Civil War era, where our country was splitting in ways that were based on, splitting based on lines based on race and really morality.
I don't disagree. It's because once you no longer really respect the rule of law, that things are out the door. If you're going to twist laws in order to regress voting rights, and that's what's happened here. I mean, this is a regression of voting rights. I mean, that, how else can you look at it other than that? It's and not only, and that's, again, that's not just me saying that. Those are 3 federal judges appointed by Republicans. The Supreme Court previously saying this, and now going back and reversing it simply for a partisan purpose for them to do exactly what you're talking about, is going out and pick their own voters. It's one of, you're right. It's a slope that we're sliding down pretty quick, and I just think that it sets such. It sets us up for a very bad thing if cooler heads don't come in at some point and say, all right, look, this is what we're going to do. We're going to stop this nonsense on this court. We're going to expand this court out. We're going to put term limits on the justices. We're going to have them staggered, so there's guaranteed basically that they're going to be, they'll serve 8 or 12 year terms, whatever it may be, and then we're going to stagger them so that each president will have at least 1 or 2, depending on if he's reelected, and that's how we're going to do it. You don't like a liberal court, elect some sort of conservative as president and the Senate and the House. That I think, and you expand it out to where there's so much less of a chance of it being dominated by one ideological belief. And it's the same way with voting to me. Is when we talk about redistricting. I don't want Democrats to get an advantage. I want it to be fair. I'm happy with fairness. I'm perfectly accepting of equality and fairness in all walks of life. It doesn't threaten me to the least. Okay. And I don't believe the Bible or anything else out there justifies doing any of this stuff, because they've introduced religion into the politics of today. And I just don't believe that that's a cause that we can continue to fall back on, not in this country, and I'll say this too. There's this mindset, and I hear this argument all the time from Republicans, that, Well, now this ruling means no more racial districts. We're not dividing any more districts by race. And so I'm sorry you're crying, Democrats, over this, but this just means we're not going to have racist districts anymore. And we're not going to create racist districts. Listen, dipshits, that the reason we're here is because those maps, according to this Supreme Court, packed black voters into one black district and diluted their power of voting. Okay. That's what they called it, was the black district down there. Okay. And now they're going back to that map because they're scared to death to draw up fair maps. They're scared to death to draw up maps that conform to all of the norms and draw these things out fairly. That's the reason why Terry Sewell's districts come snaking up into the hills of Jefferson County over there and grabs out several thousand people, and then takes a little chunk out of the west side of Montgomery and stretches all the way down through there. And it's a ludicrous idea. It's absolutely ludicrous that you believe that this is somehow taking race out of it when it's doing the exact opposite by their own admission.
Well, and also it normalizes white supremacy, because here's the reality. Prior to the 1965 Voting Rights Act, the nation was politically constructed in a way where white males were guaranteed leadership. So the idea now all of a sudden that because we have black people able to vote and other minorities able to vote and able to assert their will to influence elections, even though that has often meant that the people who were elected weren't black but were white people, is suddenly an affront to, I think, the status quo that people who tend to be on the right-wing, conservative end of the political spectrum have wanted, because it's what they've enjoyed for years. So when they're saying, oh, well, now we won't have racially gerrymandered districts, that's not true, because going back to what was is, in fact, racially gerrymandered districts, or at least racially constructed districts, districts
and
that
were
defined.
How do you know that?
We know it because of the reality of who had the power and who and how things were composed. Again, it was based on the white supremacist ideology of a couple of hundred years in this country.
No doubt. And who told everybody that these maps were racist? Who told everybody this? The federal judges, the courts.
You're talking about the courts now, yes.
Yeah.
But I'm saying that we've had this precedent for 100 years. So to even step over the court ruling and to pretend that, before the courts got involved and activist judges, everything was not racial is a complete denial of the reality of what was in this country for a couple of hundred years.
Yeah, you're right. And it's also, the best, to me too, the best argument you've got here is so atrocious, which is, hey man, we're not being racist. We're just trying to cheat. That's the argument that they're using right now. Look, Alabama's not really being racist. They're just trying to cheat for Republicans, and it just happens to be harming blacks. Okay? What are we to do?
What Warnock said. I saw Warnock last night. I think it was on MSNBC or someplace, and he was saying that the fallacy in that logic is that race and partisanship have always been inextricably linked, and in fact, all we have to do is go back. Not even 100 years. All we have to do is go back about 60 to 80 years, give or take, when Republicans, when the Republican Party began to see an influx of the so-called Dixiecrats, because the Democratic Party was changing. And you also saw a reverse movement where you had blacks who had historically been Republicans because of Frederick Douglass and Abraham Lincoln. They started moving from the Republican Party to the Democratic Party as the Dixiecrats were beginning to take over the Republican Party. People like Martin Luther King Jr.'s father had been a staunch Republican, and I know, even my own father was a card-carrying Republican even into the 80s because, again, of the historic nature of the Republican Party and what it once stood for. So, this again, this whole thing of partisanship, having a partisan agenda or a partisan motivation somehow makes it okay. Well, no, because partisanship and race have always been smack dab together.
Oh yeah, of course it is. Of course it is. And it's impossible. And that's to me, is one of the biggest fallacies of this whole mindset. Is this right here what we're saying? Like we're arguing, well, they're together, and and these people are trying to, they're trying to say, oh well, listen, we're just doing this for a partisan purpose, and and I'm sorry that it's hurting black voters. Well, to me, what you're doing is knowingly hurting a group of people by diluting one of their most basic rights. Okay, and you're doing it for a reason that in no way could be considered good.
Right.
There's no good thing that you're trying to accomplish. You're not trying to accomplish something good. You're trying to draw a map that's favorable to Republicans and cheat. That's what you're trying to do. And in the effort to that, you're saying, well, I'm sorry that, that it got these black folks caught up in it, but this is just life now, and that to me is one of the most egregious parts of this whole thing, that somehow that is an acceptable argument to so many people out there. I mean, I understand that they don't care. We've divided into teams, and all they care about is winning at this point, and they don't really care how they get it done, even if it erodes every right that they've got. And this idea of that we're still caught up on the color of somebody's skin and the way that we're judging people, and the way that we're doing things, which is so much. It's so much a part of this still today, and it's such a disappointment, and it's so infuriating, and it's, I mean, the idea, I mean, it's so stupid all the time. I tell my daughter all the time, I say, people, because she's getting a little older, and she's seen some of the movies, she's seen some of the things, and asked the questions about it. And I'll say, look, judging somebody by their skin is as stupid as judging them by their hair color. Do you dislike somebody because they're blonde, they have blonde hair or black hair or red hair? And she said, well, no, she did say sometimes if they're bald headed, she didn't care for them, but, that is understandable. So she's got a really great sense of humor from somewhere.
Yeah, clearly.
But anyway,
where she gets that from.
Yeah. And she's also a bit of a smartass. And I really don't understand that. I don't know where, I must be her mother. But anyway, I mean, it's just, there's no noble reason for doing what's taking place. There's no noble reason. And you can't justify it. Yeah. I mean, if you were coming in and saying, okay, look, these maps are so bad, and they disenfranchise Hispanic people, or they disenfranchise Asian people, or there's this group of poor people that were drawn out historically over here, and we need to fix that. And the result of that was in somehow harming, to a certain degree, another group that was enjoying rights because these folks had their rights diminished. Well, okay. I mean, you're making an argument for helping someone else. You're not making an argument for helping anything. You're not making an argument for progressing voting rights. You're making an argument for cheating and rolling it back, and in the meantime hurting a whole group of people.
And they're justifying it because they're hanging on to this fallacy about the reality of impact versus intent. They're still trying to say, having a racist impact doesn't make something wrong. It's the intent that makes it wrong. Well, you could apply that same logic if you want to go back, over 100 years. You could apply that same logic to lynching. Well, we didn't lynch that man because he was black. We lynched him because we believe he committed a horrendous crime. Well, here's the problem. You didn't lynch white men for that.
That's right.
You didn't lynch
right.
white men for that, but you lynched black men, you know, and black women and children. You know, there's this whole idea of trying to create this sort of false logic, this false dichotomy, is something we're going to have to continue to fight. Impact matters. Intent isn't the only thing that matters. Impact matters too.
Yep. Yeah, you're 100% right. And I just, it's so disappointing that we're here. It's so disappointing that this is the world that we're now living in. But look, there's a way to beat it. And the way to beat it is, it's not fair, but you're going to have to outwork. You're going to have to outwork them even harder. You're going to have to get out and vote. You already know things are terrible. As a matter of fact, we're about to have some folks on from the Southern Poverty Law Center to talk about our healthcare situation and the closing of rural hospitals in this state. All of this under Republican rule. And while they have failed to pass Medicaid expansion and a number of other things that would have eased some of this and helps out some of our poorest residents of all colors, we're still governed by these folks. And I just hope that this is the wake up call for a lot of people to get out there and vote and make a difference in this thing, and make a difference where you live, from the ground up, from your city council to your county commission, all the way up to the all the way up through the state house and into the governor's mansion. I hope this is a real wake up call for that. All right, we're going to slide out. We'll come back in just a minute. Alabama Politics This Week. We're back in a moment. All righty, welcome back. Alabama Politics This Week. Josh Moon, David Person, and we are happy. Man, it's always nice to get the folks from the Southern Poverty Law Center on because they know what they're talking about. They've got reports, they've got stats, they do fantastic work. And somehow or another, despite all the folks that we've had on from Southern Poverty Law Center, we have somehow found two folks who have never been on. Theresa Lau is the Senior Policy Counsel for Eradicating Poverty, which is what a great title. The Senior Policy Counsel Eradicating Poverty. That is so great. Gina Azito Thompson, Policy Analyst, also Eradicating Poverty. God, welcome in. Thanks for joining us.
Well, thanks for having us. I see some of us, not to name any names, have an Auburn shirt on, but I want to say roll tide this morning. It's a beautiful day here in Tuscaloosa.
Oh, is it? Is it a beautiful day there? No, hey, what time does the softball team play?
Look, we won't talk about
because I know
softball.
what time the Auburn baseball team plays on Friday in the Super Regional. I was just wondering if it conflicted with that,
Meanwhile, I'm representing Alabama A&M University's ladies basketball team, Big Energy.
There you go.
So trying to dissipate this Auburn Alabama feud going on here.
Although I will say, I've always been a tiny bit more of an ASU fan. So,
I've noticed that, Josh, and I don't hold that against you. I like my man Quentin Ross down there. Quentin's a good friend. I understand.
But hey, listen, we're not here to talk about that. We got Theresa and Gina. And Theresa is as bored as anybody could possibly be with all of this. Could not care less. Where did you go to school, Theresa?
I'm from Boston originally, so went to a women's college, so wasn't really big on the college sports, unfortunately.
Yeah, that's probably the best way to go, honestly, because this gets to be ridiculous. It really, really does. But it's a lot of fun. It's a lot of fun, and and it allows you to hate people for no reason at all. And who doesn't need that more, right? But. Okay, so all right, we got y'all on because there has been a report. The Southern Poverty Law Center has put out a report about hospitals, about rural health care in the state of Alabama, which we all know is terrible. But tell me about the report. And this is for either one of you, whoever feels more comfortable answering. Just tell me about the report, what it did, what it looked at, and what it showed.
Yeah, so we released a report at the end of May, and it looks at the impact of H.R. 1, which is the budget reconciliation bill that was passed back in the summer of 2025. It looks at there's several components, but this paper specifically focuses on how HR1 and the cuts to Medicaid and the work requirements and things like that are going to impact rural healthcare across the Deep South. Here at the Southern Poverty Law Center, we focus on 5 states: Alabama, Florida, Georgia, Louisiana, and Mississippi. And so the paper focused on those 5 states. It looked at the current status of rural health, the current status of rural hospitals, the rural hospitals that are at risk of closing, as well as the rural hospitals that have already closed, and how policymakers can and should make improvements to rural healthcare so that people and families can continue to prosper across the Deep South.
What stuck out to you? What would be 1 or 2 or 3 or 4 of the key takeaways from this report?
Well, there are quite a few things. So one of the components of the HR1 kind of package was the Rural Health Transformation Fund. It's a 5-year program that is really meant to innovate access to healthcare. So states were able to submit applications for how they would use this money. It's $50 billion across the 5 years. And so $25 billion of that was going to be split evenly for states. And then the remaining half, 12.5, is allocated to states based on a point system. And then 12.5 is just kind of discretionary, given to states through the CMS administrator, just kind of, deciding who gets what. And so what I found to be interesting in that fund is that the cuts to Medicaid and things like that are permanent, but this fund only lasts for 5 years, and it's not necessarily going to replace the damage that's been done, as well as because the fund prioritizes innovation, it doesn't necessarily mean that the hospitals that are currently at risk will get access to those funds. A lot of states chose to, in their application, say that they want to invest in telehealth and mobile delivery services and things like that. But in the Deep South, and including Alabama, people are still struggling to get access to broadband and internet. And so if you live in a place, say, for example, Alger, Alabama, where you don't have access to the internet, well, how can you go to a telehealth doctor's appointment? And so that was interesting. I think that's one of the takeaways. I don't know. I'll pause there. Theresa, was there anything that you wanted to add?
Yeah, I think that one of the things to talk about too is, even though Alabama is not an expansion state when it comes to expanding Medicaid, there's still going to be impacts for what the HR1, the so-called one big beautiful bill would do to our state. The changes to the work reporting requirements, like that piece in particular, while isn't supposed to impact non-expansion states like Alabama, unfortunately, we already are seeing states like Florida trying to impose these, burdensome requirements that are ultimately meant to force and make it frustrate and make it really difficult for people who need healthcare, who need support to be able to access to those critical, basic needs programs. And so that's something we're looking out for in terms of what these changes mean. And these changes, a lot of them are going to really start. You're really going to start seeing them happening at the beginning of next year, right? The shifting of that, as well as some changes to how states can pay for healthcare, whether through provider taxes or state directed payments. And so those are also areas, in addition to eligibility. There's a massive change in terms of who can be eligible for Medicaid and other programs too, especially for immigrant communities. And so that's something that we really want to, lift up in terms of the folks who will be most impacted by these upcoming changes. And I think just this week, CMS, the Center for Medicaid and Medicare Services, they just released their new rule, or basically regulatory action around how states are going to be implementing work reporting requirements. And so we're still analyzing that, but suspect there's going to be some significant changes and impacts, in particular around who can qualify for an exemption for, supposedly there's an exemption for people who are quote unquote medically frail, but the reality is it's really difficult for folks to both prove. They may have a, chronic health condition or some sort that would prevent them being able to satisfy these requirements. But secondly, I think that the latest analysis of that regulatory change is that they're suggesting that people would have to actually have a doctor say that they can't, because of this condition they have, they can't work. And that's something that most providers wouldn't be able to do, right? Most healthcare providers are like, I'm here to treat you, to talk about your condition and be able to support you in your medical needs. I can't, make that, that decision or that analysis of whether or not that is enough for you not to be able to, satisfy these requirements. So.
Yeah. Well, look, if we don't kick these people off the rolls, how are we going to be able to afford the private jet tax breaks? I mean, what are the billionaires supposed to do, guys? I mean, come on.
Hey, Gina and Theresa, I want to ask you a few questions. One, my understanding is from this provision that was in the so-called One Big Beautiful Bill, HR 1, Alabama was supposed to get about $100 million, I believe. Is that accurate, or am I misunderstanding something there?
Do you mean with the rural health transformation fund?
Yes.
Yes. I don't have the numbers right in front of me, but it does sound familiar. Like I said, the total pot was $50 billion. And so it wasn't allocated based on, say, for example, how many at risk of closure rural hospitals each state had. It was just based on the application that was submitted and the discretion and scoring based on, how close are you to the administration's interests and initiatives that we're focusing on.
Well, whatever the exact amount is, I know Alabama, it was being touted by, Republican Senator Katie Britt, and I think some other state officials as a real boon for the state. Like, there was going to be this huge infusion of money. But I just think, and I want to clarify, based on what you've just said, it sounds like that's a front end infusion of money, whatever the amount is, that will not suffice in terms of long-term medical needs and interests and healthcare interests of the state. And I see you both nodding your heads, so you agree with that.
Yeah, I think it's important here that we take a step back and kind of look at the pre-existing conditions, so to speak, of what's going on. So across the Deep South, we have high levels of people experiencing poverty, communities that are already vulnerable, and we have Alabama that has not expanded the Medicaid program, right? And so at the end of 2025, what also happened was the enhanced premium tax credits expired. And so now we have people who perhaps their, premium for their family to continue to receive healthcare, it doubled. And so if you can't necessarily afford that, well, then you would probably drop your health insurance. And so when you have rural hospitals that are already struggling to make ends meet, to pay their staff, to care for their patients in a proper and safe and way that is equitable across the board, when you are then losing patients because they can't afford to go to the doctor when they need to, so they're choosing not to, or if they're delaying care until it's, a medical emergency, a medical crisis, there's no guarantee that the hospital will get that money back after they treat the patient. And so that would perhaps make them run in the red even more budget-wise. And so one thing that this paper noted, and what I think it's important that we don't lose sight of, is that the cuts to public assistance programs across the board were very large. These, quite possibly the largest in the history of the programs. And so, yes, it is important that we are prioritizing innovation. Innovation is good. Mobile delivery and telehealth are great things, but at the same time, it's not an equal measure to protect the hospitals that are already running, the hospitals that are already struggling. And so I think it's important, yes, we continue to innovate, but also we, prioritize the Rural Health Transformation Fund to hospitals that could use the money.
But again, this is a temporary funding mechanism. It's not going to be, we don't expect to see anything like this again in the near future. So its impact is very front end and consequently limited. I want to ask you also about the whole, where we stand really with Medicaid expansion. Did you, in your research, did you find that perhaps it is now pointless for us to continue hoping that one day Alabama will expand Medicaid, that really that whole idea is now sort of a dead issue?
I think the topic of Medicaid expansion, when you talk to policymakers, usually there is bipartisan support. Say, for example, take Mississippi, where expansion has not happened, but in past legislative sessions, the bills they've received bipartisan support across the board to expand their Medicaid programs. I think generally policymakers want their constituents to have access to health care. And I think Medicaid expansion is necessary. It's important to ensure that everyone, regardless of their income, can access the doctor. So I think it's still important. I think it will be an evergreen issue. People will always get sick. Unfortunately, people will always need to go to the doctor. So I think policymakers can and should be focusing on ways to help their communities get that healthcare that's important and what they need. I don't know, Theresa, what are your thoughts there?
Yeah, no, I agree with Gina. Like, I feel like expanding Medicaid is an evergreen issue, and it always will be important because we know that when individuals have healthcare coverage, their healthcare outcomes improve, right? They see the doctor for preventative care, for well-wellness care, and everything, and be able to see a healthcare provider, being able to have healthcare coverage will strengthen both communities, will strengthen children's healthcare, will strengthen hospitals because they'll be able to get insurance coverage for the care that they're providing for their patients. And so expanding Medicaid, in some ways it's even more important given the expired ACA enhanced premium tax credits, which were tax credits that had helped individuals with low and medium income individuals be able to afford healthcare. Without that additional support, it's making it even harder for folks to be able to maintain healthcare coverage.
Okay. Let me ask you one final question. Your focus has been on the unfortunate impact that a lot of the recent decisions that have been made have had on rural hospitals. I'm curious to know, are urban, and I put that in quotes because I'm not exactly sure how you would even define or distinguish between the two, what your criteria is, but for urban hospitals, has there also been a negative impact, or are they relatively safe compared to what we're calling rural hospitals?
I can't necessarily speak to that. With this paper, we did focus on rural areas and rural communities. But what I can say is that the enhanced premium tax credit expiration impacted everyone across the board. And so whether or not you live in a rural or a more urban area, people need health care. And if they can't afford their health care anymore, I'm sure we'll continue to see the trickle down effects of that across the board for communities and families.
Yeah, it's really, if you sit back and think about it, it's really such a stupid way to do healthcare, isn't it? I mean, you look at countries. We went to Europe a few months ago and spent some time in London and Paris and just talking to people. It's so striking to them the worry and concern that Americans put into their healthcare. that they have to, that being able to pay for it, being able to afford it, being able to have access to it. It's so striking to them that this is such a concern because it's something that they legitimately don't even really think about. They don't even consider it on a day-to-day basis. I mean, imagine that life. But one of the things I did want to ask before we let y'all go is, we know that there is there's a crisis. A lot of people, myself included, have written about this crisis of rural healthcare and rural hospitals being on the verge of closing. So many have already closed, and not just hospitals, but birthing centers and everything that have closed in these rural areas. And now we have ambulance deserts out there, which I believe last I saw, 65% of the state was in an ambulance desert. Which, my God, so. Did this report look at all of that? And is there any hope from this fund that we're talking about that any of those problems can be addressed in any meaningful way?
That's a great question. We did in the report look at, say, for example, maternal mortality. We talked about Harmony Stribling, who was living in rural Mississippi in 2021. She unfortunately passed away on the side of the road trying to access an emergency room that was 30 minutes away because the one closest to her had closed in 2013. And so what I think is important here is that, yes, communities are currently experiencing this harm, but it doesn't have to be that way. Like we can pause, we can reverse the HR1 cuts. We can make sure that states have the discretion to keep their hospitals open. We can make sure that states are prioritizing funding going to hospitals so that they can keep their doors open, so that people can access emergency health care, the doctor, these birthing centers that are so important, especially in a country in the Deep South where maternal mortality is so high, especially for Black women. So I like, it doesn't have to be this way. It shouldn't be this way. Those are my thoughts there. And hopefully the policy recommendations at the end of the paper to prioritize the hospitals that are running in the red, hopefully, policymakers will listen to that. Because at the end of the day, it's really people in communities that are suffering and paying the ultimate cost, unfortunately.
Yeah. Theresa, before we go, let me ask just one thing. And that is, it's kind of a broad, I don't know if it was covered by the report or just, life in general, here. There seems to be so much hopelessness with ever being able to correct this, which is continually dumbfounding to me, because everybody hates this system. Everybody hates it. You talk to rich people, poor people, middle-class folks, all races and nationalities. Everybody hates this system. They all hate having to go through an insurance company that gets in between them and what treatment they can get. They all hate the fact that it costs so much. They all hate that millions of people were just booted off of their insurance, which we know is going to be devastating for them and raise the prices for everybody else out here. So y'all deal with this all the time. Why do we keep it? Why is there not a better solution put forth and a movement to say we're not doing this anymore?
Yeah, that's such a good
yeah,
question.
Listen, and be precise and make sure we're all on board. So
yeah, I have to think about this a little bit because so I focus very much on like the federal healthcare access work, and obviously Medicare for all is a big push that a lot of folks nationally and across the country are talking about, and like wanting to have better systems that can provide universal care for folks. Obviously, like that is like in terms of gold standard and thinking about like other countries and what they do and how they can provide care for as many people as possible. I mean, right. That's always the pie in the sky, right? But then there's also thinking about like there are different ways to reform and reimagine how our current like healthcare systems and our healthcare coverage works, whether that's like trying to encourage more categorical eligibility for healthcare. Like, I think, for example, if with SNAP and like food stamps programs, for example, if you are qualified for, the temporary assistance for needy families program, you automatically qualify for SNAP and for food stamps.
Right.
If you, or like similarly with food stamps and SNAP program in general, like if you're at a school that is low income, that like a certain percentage of the students qualify for free and reduced lunch, the entire school gets free and reduced lunch, right? I think there are ways and systems in which we can like look at some of these other programs that are doing like categorical eligibility there. Thinking about like automatic enrollment, about paperless enrollment, about making it easier for folks and eliminating the barriers that exist for people to be able to get access to healthcare coverage, be able to get access to ways to support, supporting, paying for the healthcare that they need. I think that is important and helpful. But and I know you name it. It's like sometimes with the healthcare system also, there's a lot of things that we need to think about in terms of reforming and making it better. And, maybe it's rebuilding a whole new system, like who knows? But I do think that like we have to keep in mind that there are, the way that we have our systems right now, there are opportunities to really make that better.
Yeah, there's no doubt. My my wife works in insurance, handles a Medicare program for elderly folks, and the conversations that I overhear are so mind-bending, and just I got to get a prior authorization before I can allow this person to come and transport an individual to a hospital or a doctor for care. Otherwise, they might die, but we can't get the authorization in time because those people have gone to lunch. And it's just, those sorts of things. And she bangs her head against the table in here, all the time. And it just befuddles me while we're here. But hey, look, thank you guys so much for coming on, Theresa and Gina. Thank y'all for the work that you've done, for spreading this out. And I'm going to write something about this as well, and get the report and get it out to folks and let people see it. And hopefully somebody will pay attention to those recommendations at the back of the report, and read along and understand that there are some ways that we can make some changes to help the people of this state, and let's maybe do a little bit better and just help folks. So, but thank y'all for coming on. I really appreciate it.
Yeah.
Thank you for having us.
All right. That is Theresa and Gina from the Southern Poverty Law Center. They are fantastic at what they do, as is the Southern Poverty Law Center. We really appreciate them and all the work. And we'll be back in just a minute. It's Alabama Politics This Week. Back in a moment.